Taking care of your teeth. I hope I'm making you smile right now. We only get one real set of these things. We got to take good care of them. My son right now is losing his teeth, and I'm just really all over him of teaching him good dental care, how we take care of our mouths, oral health, because I'm like, your next ones are going to come in, and then that's it. I know there's dentures, but you only get one set of real ones. How do we take better care of them? How do we do it naturally? What are the rules and the things that I follow to make sure and what to watch out for? And then what is a solid dental regimen to help undo dental damage you've created or avoid more in the future? Let's go. These pearly whites. So when we take a look at dental health, there's a couple of things to be looking out for. Obviously, brushing and flossing, super important. I'm going to show you a couple of tips of what I do, as well as gargling in a little bit of what I recommend for mouthwash, what I do from a floss and food in between the teeth and keeping those clean. But twice a day, morning and evening at minimum, dental problems and risk factors go up the less you do that. That is proven. So number two, grinding your teeth. We need to address some of the things that go on with the jaw and with, the TMJ and your posture that can lead to some of those things. High acidic foods is a risk factor. If you're eating a lot of that, it can wear down the enamel that is designed to protect the teeth, and then you're at high risk of having more dental problems. And then finally, metal. Metal shows up in the mouth all the time. So metal posts for implants. We got metal fillings. The rule is try to always keep metal out of your mouth. Why is that? Well, when my dad had a lot of health issues back in the day, you can read more about his story in my book that's just listed below. One of the things we checked was the amalgam fillings inside of his mouth. And my dad had 11 amalgam fillings, and one of them was actually, he had a fake front tooth. They had taken his front tooth out, and they had implanted amalgam filling at the bottom of the root canal at this upper tooth, and then put the tooth back in there. So he had mercury buried inside of his lip, and he had it all throughout his mouth. So we actually took an electrical charge, put it in his mouth, and tested the charge of his mouth compared to the rest of his body. It was off the charts. The metal was creating a disruption of the electricity of his body, which not only messes with just normal flow of the nervous system, but impacts the heart. My dad had a bunch of heart issues. So we knew that was one of the factors leading to it. Then we went and tested heavy metals in his system, and we found out that he had high levels of mercury, which was more than likely coming from his fillings. So don't rush out right away to get all the amalgams taken out of your body. You want to properly be able to do it over time with someone that is a naturally certified dentist and taking those out, because you can release a lot of toxins into your body if you do it inappropriately. And the next time, if you do get a choice and you do have a tooth issue, avoid putting metal in or metal implants. Go for bridges more often, or a porcelain filling, no metal filling. So try to keep that out. For the teeth and the grinding side of things, I'll post a TMJ video and link for you below to get more resources out of that. And then if you need help with eating the proper foods from an acidic standpoint, that's going to be broken down below for you as well. There's some resources there, because diet is the main thing your mouth is trying to tell you if it does have infections and it does have flare-ups and it is hurting. You got a nerve exposed. You got an abscessed tooth. You got infection somewhere in there. Your gums are starting to hurt. That is a reflection of what's going on inside of you holistically. So systemically, the body is inflamed and it is infected or irritated. That's going to show up a lot of times in your mouth as a reflection. So first thing to change is what you're eating, lowering the carbohydrates, lowering the processed foods, putting in more fruits and vegetables, very important. Again, there's guides down below to help you do that. So any signs of infections or problems with the mouth, look to the diet first. Avoid the fillings, like I said. Let's go over some remedies and some natural things you can do. I don't have a single cavity. I don't have a single filling inside my mouth, and neither does my family. So what do we do on a regular basis to take care of our teeth? So number one, oil pulling. Oil pulling is very good if you have an infection or you have irritation inside of your mouth. You simply take a tablespoon or two of coconut oil. I would use unrefined cold pressed, and you are just pulling it in and out of your teeth, swishing it around and pulling it in and out. You could have a little container of it. Oil pulling, great way to help kill off some of the 700 different types of bacteria that end up in your mouth. Whew, nasty. So don't swallow it when you're done pulling those out of the system. Another thing I love to do from a hygiene of the mouth standpoint, I don't have any gargle or mouthwashes or Crest or Listerine or anything like that. There's a lot of chemicals in those. There's a lot of toxins in those. Use hydrogen peroxide. Real simple. The one you buy at the store, you can cut it with water if you want to, but you simply spray some of that in your mouth, swish and gargle it around for 30 to 60 seconds, spit it out. You can do that 2 to 3 times a week. You can do the oil pulling every day if you'd like. Those are very good ways to just get the bacteria and clean up what's going on around your teeth. The other one I use if you have a significant infection is colloidal silver. We use a serum that you can spray. It's patented technology where the silver is imprinted into the structure of water. You can spray it in your mouth. It's a very good antimicrobial that could be used. And then outside of brushing morning and evening, I would also look at using a water pick. A water pick is a device that sends high pressured water in a very narrow stream, and you can run it in between your teeth. So it's spraying water in between the teeth. I use it in the shower, and so it's like flossing. You can floss and brush. We all know or have a good education on how to do those things. I definitely still do those, but I also use a water pick to run in between the teeth. Very good way to be sweeping bacteria, food particles, and anything stuck in between the teeth with just the pressure of water. It's a gentle way to do it. So in the shower, a good option and way to do it. Mine just sits in the shower and I can use that regularly. So there's some general tips on what I'm doing on a day in, day out basis to keep the mouth healthy, not taking in toxins, not taking in things that are going to damage the teeth, avoiding metal, and then seeking out a dentist that has that similar philosophy. The one I go to is a holistic dentist. That's what I would be looking for when I'm looking for a dentist. The one that's in alignment with keeping the teeth the way they are and prolonging as long as possible, doing more work to the teeth. Because as soon as you put a cavity filling in there, every time you eat cold and hot food, it expands and contracts, eventually cracks the tooth, which leads to a root canal. The root canal then leads to either metal or bacteria being trapped at the bottom of a canal. That's going to increase infection inside of your body, potential heart issues, and if there's metal introduced, then you're messing with the electrical charge of the body. So common dentistry has really failed us. There's some insight on how you can get more educated on it. If you do have the amalgam fillings, seek out a holistic dentist. And for your year-to-year, month-to-month care, seek out a holistic dentist as well. Practice those tips that I gave you in the video. They really do work. Coconut oil pulling, hydrogen peroxide flushing, brushing, flossing, and potentially use a water pick. Really good ways to take care of your teeth from a natural perspective. I just want to keep bringing solutions to you to make health simple. So check out the resources for you below and subscribe to the channel for more tips coming soon.